everybody, welcome to my channel. If you're new here, great, because I'm new here too. So just a little introduction about myself. My name is Ainel. I am a nurse practitioner that also practice as a RN in the hospital and a NP on my off days as part-time. So today I'm going to bring you guys along with me to show you guys like what I do as a home health nurse practitioner. And just to let you know about this channel, it's going to be all things educational, lifestyle, and nursing. So you guys can call me Nelly or Nell. Nurse Nelly is what some people refer to me as. So there you go. And so yeah, so today I'm going to bring you along and show you guys like what I do day to day on a home health nurse practitioner day. So I hope you guys like this brain fart footage that I'm going to have for you guys today. And yeah, so let me show you guys like what I wear and why I wear it. Just come with me. Okay, so essentially what I will wear, just some basic all blue scrubs, and I will wear Crocs because it's easy to put on and take off, because some people house you want to be respectful and take your shoes off. I do wear this NP jacket that I got made because it is too hot. Let me see if I can zoom in. It is too hot to be wearing a white coat, so I just wear something basic. I don't wear my good scrubs because some people's houses are not the best, in the best conditions, I say that. But yeah, so this is basically what I wear. I will wear either all blue or all black. And yeah, that's it for the outfit check. So yeah, my Crocs are downstairs, but this is what I would typically wear if I'm going to do home health. Now in the hospital, I'll be wearing prints, colors, all of that stuff. But yeah, that's it for that. Okay, so we're here at the first client's house, and this client is a follow-up. So meaning this patient was probably in a hospital or in a rehab and just came back home. So we're going to follow up to see if she needs anything. And while we're on the topic, I want to talk about some pros and cons of home health nursing, because there is a few. So we'll start with cons. Living in Los Angeles, definitely the con is traffic. I don't know, it seems like depending on the time of day, you know, you have your certain places like where you go, it's like, okay, you know, from this time to this time it's going to be traffic. No, LA is like, it's just like unexpected, like it's just unexpected. The only time you probably will not see traffic is between midnight and like 3-4 a.m. or something, I don't know. But yeah, traffic. Another con is parking, and that's especially if you're going to a place with like apartments, you just guaranteed to be like, okay, you might have to find parking, so you have to get there a little bit earlier. Another con would be the scheduling. So what I mean by scheduling is patients are scheduled, but sometimes patients cancel. So I mean, you know, it's good, but it's like, okay, I wasted my time. So it's kind of good to call the patient before, just to be like, hey, I'm on my way, because you would get there to this place that you're going to and they're not there, or they don't want to be seen today, or they're just not feeling it. So yeah, you probably wasted your time going to that client. I'm gonna use client and patient interchangeably, sorry. But yeah, so that's a con. Another con is you just don't know what you're getting yourself into. So like when you're gonna go visit these patients, you don't know their lifestyle, you don't know how they're living. Sometimes if you Google the address, you can kind of figure out if they live in like a boarding care, a SNF, a rehab. So it kind of will give you an idea of where you're going. But 9 times out of 10, you know, you don't, especially if you've seen these patients for the first time, you don't know what you're getting yourself into. Luckily for the year that I've been doing this, year and a half now that I've been doing this, I only came across maybe one sketchy place where I was just like, No. No, we're not doing that one today. And maybe about 5 homes maybe that were like really just not in great conditions. But other than that, I mean, everything's been good, really good. So I would say those are my only cons. My biggest, I will say, the pet peeve is just like finding parking, because that can take up your whole time. But the pros outweigh my cons. It's flexible. I work when I want to work. I take on how many patients I want to take on. Before, I was doing between 13 and 14 patients a day, which was good, but you're on a time constraint. Like, especially me, like, I like to be home before 6 o'clock, and sometimes you're out with patients until like 7 p.m. I guess that would be a con, huh? The timing. But that's if you take on the max amount of patients you can, because you have to incorporate the fact that some patients love to talk, and then when they love to talk, you will be there for longer. But other than that, it's flexible. You meet a lot of new people. Like, one community of people is so nice. Like, every time I come, they're offering coffee, chocolate, or candy. Those 3 things: coffee, chocolate, and candy. And I used to come home with like bags of stuff, like, to give to my kid, like, amazing. So you meet great new people. You learn a lot about your city or county, because LA County is big in a whole. So I've seen a lot of beautiful places I didn't even know existed out here. I've seen a lot of farmer markets that I can now go to. A lot of shopping centers. Oh my gosh, we got so many shopping centers out here. It makes me spend money though. But shopping centers. And just like the freedom of, like, doing what you want. In between patients, you can go like shop or handle something that you need to handle. I know it's like less than the cons, but I mean, flexibility is always a big plus for me. I work on my own time because I do work in a hospital full time. And so working part-time as a NP gives me a lot of flexibility and extra income. One thing I will say too, I forgot to add on the cons, is that the charting, though. The charting sucks major. Like, in reality, I would love to chart like while I'm with the patient, but it's just not going to happen that way. Because the charting is so long. Like, it's not even the fact that it's long, because you just go by systems and then you have to put in your your note, but it's like time consuming. And so it's like sometimes you be up, especially if you have, imagine the max load of patients. If you have like the max load of patients, oh yeah, charting is ridiculous. But other than that, I mean, the freedom outweighs it all, because like you're like, oh, I don't want to work today, or I need some extra money, I'll go work. But yeah, so those are my pros and cons. I love it. I mean, especially if you're a new NP, I will say get your foot wet with being home health. I mean, it's not for everybody though. It's not for everybody, but it gives you great autonomy. It's like you practice on your own. You know what I'm saying? Like, you figure out the patient, you're learning the patient, you're looking at their medications, their diseases, and then you're figuring out, especially as a new NP, medications to give, and that's what some people are scared. It's like, oh, the prescribing. It's like, what do I prescribe? You don't want to prescribe the wrong thing, but always keep up to date with medications and diseases, because things are not going to change. Diabetes isn't going to change. Hypertension isn't going to change. High cholesterol isn't going to change, So some things will not change. The medication stays the same unless patients have like reactions to medications. Then you want to change. The good thing about home health too is like you always have a overseeing physician, so you can always ask the physician questions in their thoughts on medications as well. So yeah, so that's just some things. If you guys want to know more about home health, of course, feel free to drop a comment or message me. I would love to answer those. But yeah, so let's get ready to go see this patient. just a follow-up. So we're going to see if she needs anything and how she's doing after, I believe it's hospitalization. But yeah, I'll be back to report to you guys and let you guys know what had happened and what are our next steps. Okay, so I just left my patient. The reason why I'm seeing her, she recently just had like a stroke in March. So that's why I was just following up on her. So I'm going to order her some physical therapy and occupational therapy. And she has like a small like little rash like on her bottom, because now that she's in diapers, she's not walking and talking like she was. And it's so funny. It's not funny, but it's so crazy how life can change. Because I just saw her last year. She was full of life, full of joy, walking with her mom, because her and her mom lived together in this assisted living home. And to see now, like, things can turn any minute. But yeah, so I'm going to order her some therapy. I'm going to order her some A&D ointment and some like diaper rash creams to put down there, and some more diapers because now she's using them more often. She's wheelchair bound now, so she's not even walking, the facility manager said. So yeah, we're gonna just try to get her back to normal health as possible, because you know, once you stay that way, you start to decline if you've seen patients long term before. So yeah, so we're gonna get that for her, and then we're gonna go on to our next patient. Okay, so we're at the next patient client home, and this one is a readmission. So basically what that could means is we're just here to do follow-up, or we're here to, like, sometimes they like not lose, but they'll be away from home health and then they have to come back kind of thing. So like essentially you don't have to really do all of the initial assessment, but you do, if that makes sense. Like you still have to do head to toe, like everything, recon, medication. So basically readmissions are essentially initial patients, because we've seen them before. Sometimes they switch home health. Sometimes they don't recertify in time, so they have to do the process over. So things like that. But yeah, so we're going to go and do a readmission, and then we're going to do a cognitive test on them too. Usually we do a yearly cognitive test, so that's all that we're going to be doing. And yeah, I'll report back to you guys. All right, so the patient I just left, I seen her before too. She looks good, looks great. She was recently in the hospital. She was vomiting profusely while she was at her adult daycare. She had refused to go to the hospital, but they kept telling her, no, go, go, go. Her blood pressure was in at 200. She's like, no, I just need to go home. I'm like, no, you needed to go. She's like, I know. But anyways, so she went home and started vomiting up bile. So she eventually went to the hospital. They diagnosed her with UTI and pneumonia. I honestly don't think it was pneumonia. She said she wasn't coughing. She didn't have any mucus or any phlegm. She wasn't short of breath or anything like that. She wasn't coughing up blood. I don't think it was pneumonia. They did a chest x-ray. The x-ray showed it wasn't pneumonia, but they still diagnosed her with pneumonia. Lungs today were clear. So they gave her some prophylactic antibiotics to take. So she's taking that. She doesn't have any symptoms or anything, but I am going to give her physical therapy because she's been having back pain that she says starts from her thigh and radiates up her spine kind of thing. So she do talk to doctors. They order MRIs, more CT scans, but she said they only do half the body. She wants the whole body MRI, which I completely understand. So we can order MRIs. Only thing is, it's like for home health, it's kind of hard getting them into those facilities. So I'm going to order it to see if she can get a whole body MRI. If not, then she just have to continue with her physician. But I will give her physical therapy. She's already taken gabapentin and diclofenac, which she says helps a little bit, but makes her sleepy, which is a effect that gabapentin does to a lot of people. Says that gabapentin makes them sleepy, so she uses it more at night to help her with sleeping. Other than that, she's well. Everything was good today. I honestly don't think it was pneumonia. I think it was more of a reflux kind of situation, because she said once she touches her chest, at the time when she was vomiting, she would touch her chest and then the pain would ease up a little bit. But yeah, her troponins were good. I was looking at her lab, so she didn't have like a mild heart attack or anything like that. So yeah, so I told her just, follow with her physician. I will order more labs as well, and then physical therapy. All right, on to the next patient. All right, so this patient was a recertification patient, basically. So every so often, patients get recertified to see if they still need home health, if they still want home health, da 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 da. So yeah, he's a recertification. They are requesting a walker, a wheelchair, and a hospital bed. Patient ambulation is declining, meaning he's walking a little bit more slower. He had 2 falls within the last month. So of course we're going to get him some occupational and physical therapy, and we are going to put in a request to order the hospital bed, because the one he has now he can easily fall out of and slide out of, and it's hard to get him like up, so it'd be better for mobility. Wheelchair with help. They're just requesting a little manual one, so that's not bad. Usually insurance don't want to cover anything really, but especially electric wheelchairs, those are, you need to go through hoops and all that stuff for that. But we're going to order that for him, and yeah, on to our next patient, which is a readmission patient. So yeah, all right. All right, so that patient was a readmission. I love him. He's so nice. He made my day. But anyways, so yeah, I seen him before. He lives in a boarding care facility. Usually I like going to boarding care. It's a lot of people, so it's not scary. But yeah, so he just need refill on medications. Nothing changed. He's doing well, doesn't need any physical therapy or any other therapy, or needs to see a specialist. So now we're going to go on to our next patient. All right, so this patient was a return of care patient actually, and that just basically means same thing almost as a follow-up. It's like they either been hospitalized, anything like that. So once they go into like a home or being hospitalized, they have to return of care. So we have to see if they even qualify again for home health, da 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 da. So she was in a hospital, been in a hospital in and out this year due to a brain tumor, and so suddenly the brain tumor has been making her have changes. So I just followed up with her. She does has a neurologist and a primary care doctor, which is good. I'm just going to I'm going to add a medicated shampoo for her, and I think that was it. Oh, get her some compression stockings, and that's it. And then we have one more patient to go see, which is this recertification. So yeah, see you after the next patient. Okay, so I thought I'd chop it up with you guys for a second while I'm waiting for my next patient. We're going to have to do that pros and cons list over, because I realize as I've been driving around, I missed some things that you guys should know. So we're going to do that list over in another video. But like right now I'm waiting for okay, so I'm at a patient's house, but they have a gate, and one thing about, I do not walk into gates. I don't care if it's unlocked. I will call you first so you can meet me, or tell me it's okay to walk in. So they have a gate. I called both the numbers on the phone, Both the numbers on the phone, both the numbers on the list, but no one's answering. So then I have to call my office. Well, text them. We in like a message group, so I text them to see if they want to try to call, because sometimes people don't answer unknown numbers. You know, I get it. I don't either. So I'm waiting on the office to let me know if they got in touch with them or not, and if not, then I'll go home. I will probably go grab something to eat, because let me see, I started at 10. It is now 2:07. I had really short patients today, so today I had 6 total. Might be -1 because this one's not answering, but yeah, so I had 6 patients today, done kind of early. I like to be done before 2, but you know, it is what it is. And yeah, so I might go chart a little bit, show you guys that, and then yeah, then it's gonna be back home, bathe, relax, and then gym time. But in the meantime, yeah, I thought I would just yap it up with you guys. Let me see. Oh, another thing about home health, it is important to have 2 phones. Let me tell you, always have one for business, because patients will contact you and they will ask for your number. So I do have like a little business phone that I carry, and patients really do call and have questions. Anytime if it's minor, I'll answer it, but like if I have to prescribe something, I go through the office, because they have to do like this billing thing. So I'll go through the office and let them know like what the patient wants and need, and then they'll send me a confirmation, and then I'll approve it or not. But yeah, do not give your personal number up. Do not. And my trainer that I had trained with, she told me the same thing, like do not, because she knew somebody who gave her number up, and the guy calls that provider for everything. So yeah, no personal numbers given out. So yeah, I just got a message. They're not answering me on their end as well. So okay, so I'll let them know. Usually we wait 15 minutes before we'll cancel it. Okay, so yeah, usually we'll wait, we give them a max of like 15 minutes, and then we do a no call, no show kind of thing. We'll cancel it. But yeah, home health is pretty good, especially if you're starting off, because like I said before, it gives you like good autonomy, and I like it because it's like a slower pace kind of thing, you know, because at the same time you're learning still, but you know, at the same time you're like, oh, you're in the realization like, oh, I'm a provider, you know. So when there's like things that I'm like not sure of, please, we're going to message the doctor that's over me and be like, hey, what do you think? The doctor looks over the chart and be like, yes, I agree with what you're prescribing, or let's try this. So it's always good to have an overseeing physician. And yeah, I just think it's a great episode. Forever grateful for my teacher, actually, who got me this job. This is her business, and she was my college professor for nursing school, and she told me about this job. So I'm forever grateful for that, because a lot of places want you to have experience first, and it's like, how do I get experience? Because ultimately I wanted to do OB, women's health, but inserting IUD scared the life out of me, and I don't know, I let that deter me, and I should not have, because you know, everything is a learning process. So I might go back and try to go for OB, but ultimately, well, that's later on down the line. That's my plans are later on down the line, but I would love to do OB, because I think women's health is important. Men's health is too. Like a lot of men, they don't realize like men's health is important, and they should seek providers more often. And I think like being an MP versus a medical doctor is way better, because people trust you more for some reason. Well, no, I'll take that back. People trust doctors more. But they don't get that experience as with a nurse practitioner, because we know we're nurses first, you know, and we know how to play on, like not play like play on people, but like play on emotions. Like we know how to tap into emotions. We know how to read people more. So I think that is like really good that nurse practitioners are able to even practice as providers, because sometimes we're more welcoming. I would say that we're more welcoming. Doctors are usually like tell you like it is. You can probably even get a question in or two, but I don't know if you get me what I'm saying. Like nurses are more therapeutic. I don't know. Like we're more there for you, you know. But yeah, so I'm really grateful for that. I just wish California wasn't so strict with like owning businesses and kind of things, because I think a lot of nurse practitioners will probably practice more, but California make it terribly hard to do that. It's a lot of hoops. It's a lot of fees. We have to pay for a ton of things to own a business out here in California. And so it's like, dang, is it really worth it? But being a nurse practitioner is really worth it. It's just, as with anything, you're gonna run into pros and cons of everything, but the real only thing for me is charting. Like I absolutely hate charting. Even as a nurse, like I hate charting. Like it just takes up so much of your time. Like I'd rather be able to write a note for the end of my shift on each patient versus clicking. Every 4 hours you have to go through clicking as a nurse in the hospital. And that's why a lot of people don't like to do bedside, because bedside is already stressful. Then you got the administrative side, and it's just like, dude, you guys are down our throats. The patient's down our throat. We're trying to keep our patient alive, you know, and healthy. And it seems like to hospitals, the thing that comes first is charting. Like they don't care about nothing else. They just want charting done. But then soon something happened with your patient, guess who they're pulling into the office? Correct. All right, you get what I'm saying. So yeah, but I love being a nurse practitioner so far. I would love to work in like a urgent care to get more experience. So I have to find like a nurse practitioner who's willing to like train, that I can shadow around to be an urgent care nurse, because I would love to do that as well, because I mean that incorporates women's health and men's health as well. And you see all ages. Now I'm scared of babies now though. I'm scared of treating babies because they're too small. They're just too small. They can't talk to me. So that's the only thing that's kind of scary. But other than that, yeah, I would love to do urgent care. I would love to have my own office or something. You know, my patients come in, we chat it up, give them what they need, and they go. So yeah, I mean, with nurse practitioner and being a nurse, period, is so many avenues. Like, I don't think I could have picked the best career. Like, if it wasn't probably for my auntie. Like, my auntie's a nurse, and she would come home and tell us like stuff that she sees in the hospital and kind of like freak her out. But I loved it. Like, yeah, so it was her. I followed her footsteps. And yeah, it's so funny because I think before, when I was little, I always wanted to be a heart surgeon. I just thought that you could just fix hearts. Like, that was my passion as a child, was to be a heart surgeon. I don't know what age, maybe junior high. I don't know what age I thought about being a heart heart surgeon. But that quickly left when I found out how much years of schooling you need as a doctor. So that's out. That's out. But yeah, I love being a nurse. Like, I don't think I could have picked a better career. But yeah. So it's nearing the time for me to go. It's 2:15. I've been here since 2:05. So they got about 5 more minutes and then I'm out. And then, yeah, you guys will see me. I'll probably go to Starbucks and get something to eat and chart a little bit, and then I'll tap back in with you guys. Bye. Guys, so I am back home. The last patient, in fact, did cancel. They are going to discontinue his home health, so whatever may have you. But yeah, that's like a little glimpse into what I do with home health. Like, it sucks that you can't like actually show the process of like how do you go to do like your head to toe assessment and everything with you guys, but HIPAA, okay, and I love my license, so we ain't gonna go there. But yeah, that's what I usually do. It was a short day today, so not that many patients. I am going to go bathe because I'm tired. Like, can't see I sleep. That's why I don't like to come home and chart, because when I come home, the first thing I want to do is go to sleep. But I'm going to chart. I'm going to sit in my little chair over here and chart on my tablet. I'm going to show you guys too what I chart on. So it's a tablet, the same tablet that we use for patient like signature and things like that. It has like a little keyboard and everything. But yeah, so I'm going to chart on that and then just relax for the rest of the day until it's time for me to go to the gym, pick up my baby, and then go to the gym. So yeah, that was it. If you guys like to see more nursing content, of course, follow this channel. Please subscribe. Hopefully another day I can do like a, well, it won't be in depth. It'll be like the same thing if I do another follow me around as an NP, because, you know, we can't show you much. So, but yeah, this channel will be all things nursing. Hopefully some like educational stuff, and if I can get this editing thing together, Lord knows, trying to learn how to edit is whooping my butt. But that's neither here nor there. I'll catch you guys in the next video. And yeah, thanks for watching, and hope you guys got some kind of insight today as what a home health nurse do, what a home health provider do, because home health nurse is totally different, but we can get into that another day. All right, bye.